India reported another record jump in daily coronavirus infections today, taking the total number of cases to 5.12 million. This as the pandemic extends its grip on the world's second most populous nation.
Well, the health ministry said that nearly 98,000 new cases were reported in the last 24 hours alone. And with 1 million cases recorded in just 12 days, India's rate of infection is currently the highest in the world. Deaths, which have been relatively low so far, are showing an uptick, and the country has recorded more than 1,000 deaths every day for the last 2 weeks.
Let's check in with India Bureau Chief Nirmala Ganapathy on India's COVID-19 situation. Now, hospitals in several badly affected areas like Gujarat and Uttar Pradesh are seeing demand for oxygen cylinders to treat ill patients triple, prompting urgent calls for help. How much stress is the public health system under?
So the public health system is definitely under a lot of stress. The thing with India is that, the infrastructure is weak in some part and it's quite strong in other parts. For instance, in the cities, the health infrastructure is quite modern. You have a good number of hospitals, you have a good number of doctors. But in the rural parts, sometimes people have to travel for kilometers to just get to a basic health facility. So what's happening in India is that, with the coronavirus now spreading to the rural parts and smaller towns and villages, there is this worry that if the cases increase, how will the health infrastructure cope? So what happened in India was that we had a very stringent lockdown, which started in March, and that kind of went on for 75 days. And that kind of gave authorities some space to kind of improve the infrastructure. So you had a lot of COVID facilities which came up. Testing was ramped up significantly. Oxygen production went up. But the problem now is that we are adding so many cases every day that all this is being tested now. See, the problem with India is there's no uniformity as far as the medical infrastructure is concerned. So that is proving to be a challenge. So what's happened is that the virus has just entered villages and the smaller towns. So the test is really ahead to see how much more strain the infrastructure can take at this point.
Right. Well, Nirmala, despite best efforts to restrict movements, they haven't been very successful in keeping the spread of the infections under control. How come?
India went into a lockdown where there were a couple of hundred cases.
Yep.
And people really religiously followed the lockdown. We weren't allowed to come out for anything except for buying essential goods. The economy was completely shut down. But the problem is that once the economy started opening up and people started traveling, the virus traveled with them to different parts of the country. So, there are sero surveys which are coming out now, which indicate that India actually had many more infections than the official data suggested. So that means the spread perhaps had already started even before the lockdown. So once, the lockdown, which also, of course, created a humanitarian crisis in the sense that migrants suddenly found themselves out of jobs and they couldn't go back to their homes. So there was a humanitarian crisis as well. So once, the economy opened up, they went home. There was cross-country movement of others. And that has kind of taken the virus to different parts of the country. So the lockdown, while it did help authorities better prepare themselves for the virus, I don't think had an impact in slowing down the growth of the virus as we are seeing now.
Now, what do you think are India's options going forward? Experts have criticized herd immunity as a viable solution, but is it India's main option now? What about a vaccine?
So I think the government strategy is to kind of just tell people, practice social distancing, wear your mask while going out, be hand hygiene, washing of hands repeatedly. And also, the fact is that India is a huge country and one strategy may not work. There's no one size fits all for the country. So for instance, in the smaller towns and villages, testing still, carries a stigma. People are scared of getting tested. So I think there needs to be a communication campaign which, targets that perhaps from the government side. So I think it's all just people kind of practicing safe measures at this point, until the vaccine comes, that is.
Well, thank you, Namla, for taking the time to speak with us. We've been speaking, of course, to Straits Times Bureau, India Bureau Chief, Namala Ganapathy.